On July 25, 1972, a bombshell report by the Associated Press ripped through the medical community and shocked the nation, exposing the horrific details of the Tuskegee Syphilis Study. For an astonishing 40 years, from 1932 to 1972, the U.S. Public Health Service had conducted an unethical and deeply racist experiment on hundreds of African American men in Macon County, Alabama. These men, impoverished sharecroppers, were deliberately left untreated for syphilis, even after penicillin became a widely available and effective cure in the 1940s. They were told they were receiving free healthcare for bad blood, a local term for various ailments, but in reality, they were merely being observed to study the natural progression of the disease. The study began with 600 men, 399 of whom had syphilis and 201 who did not. The ethical violations were egregious and manifold. The participants were never given informed consent, they were not told they had syphilis, nor were they informed of the true nature of the study. They were actively denied life-saving treatment, and efforts were made to prevent them from accessing treatment elsewhere. The researchers justified their actions by claiming they wanted to observe the full course of the disease, from infection to death, believing that African Americans reacted differently to syphilis. This was a blatant disregard for human life and dignity, rooted in deeply ingrained racial prejudices of the time. The consequences for the men and their families were devastating. Many suffered from severe health complications, including blindness, mental illness, and heart disease, and ultimately died from preventable causes related to syphilis. Wives were infected, and children were born with congenital syphilis. The study continued for decades, even as medical ethics evolved and the horrors of Nazi human experimentation came to light. Whistleblowers within the Public Health Service attempted to stop the study, but their concerns were initially dismissed. The Associated Press article, based on information from whistleblower Peter Buxtun, finally brought the study to public attention. The outcry was immediate and widespread, leading to a public apology from the U.S. government and a class action lawsuit on behalf of the victims. The Tuskegee Syphilis Study became a pivotal moment in medical ethics, leading to the establishment of strict regulations for human subject research, including the requirement for informed consent institutional review boards, IRBs, and the Belmont Report, which outlines ethical principles and guidelines for research involving human subjects. In 1997, President Bill Clinton formally apologized to the survivors and their families. The legacy of the Tuskegee Syphilis Study continues to resonate today, particularly within the African American community, contributing to a deep-seated distrust of the medical establishment. It serves as a powerful and painful reminder of the dangers of unchecked scientific inquiry, racial bias in healthcare, and the critical importance of ethical conduct in all research involving human beings. The story of the Tuskegee Syphilis Study is a somber lesson in the enduring fight for justice, equality, and human dignity in the face of systemic abuse.